Please ensure that the details above are correct for your patient. Once this has been checked, we can progress onto the Falls Risk Assessment tool. This tool comprises of 10 questions and should be completed within 12 hours of admission to hospital. The questions are listed below and they can be answered with a yes/no answer. Here, any other medical clinical risk factors can be listed. Once this has been completed, we should save and complete and print as below. If the patient does not trigger yes on any of the questions, there is not a need to progress to the next stage. This screening tool though can be reused again whilst the patient is in hospital if their condition should alter in any way. If the patient triggers yes on any of these questions, we therefore need to progress onto the full screening details. The full screening risk assessment lists the risk factors to the left-hand side. The assessment of the risk factors are listed below, and here we answer yes or no. Dependent on the answering of the question, we may need to trigger for further assessment. And to the right-hand side are the necessary actions that we need to apply to reduce the patient's risk of falls. For example, is the patient on 4 or more medications? If we're saying yes, there's a need for further assessment. Therefore, we should be ticking the medication review falls prevention box and applying the policy of having a medication review done. Is the patient on medication which increases risk of falls? If we're saying yes, again, we need further assessment and we should be visiting the medicine review. Does the patient require the toilet overnight? Yes. We therefore should be triggering further assessment and commencing a nighttime functional assessment. Does urinalysis indicate infection or further investigations? If we're saying yes, we need further action and we should be applying in the box the further investigations required. We should be providing the literature to relatives and the patients and ticking yes, further action and information discussed with the patient or if necessary with the relative and carer. All these questions should be answered in a similar way. Once completed, we should be saving and completing and printing. This assessment should be recompleted on a patient every 7 days, or if a patient changes condition, we need to review this risk assessment again. If a patient is moved to a new ward area, we need to be revisiting this risk assessment and completing it again. If a patient has an inpatient fall, again we should be revisiting this and recompleting this assessment.